Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss about CRP. We have discussed about acute phase reactants, and one of the acute phase reactants, one of the protein which is produced during this acute phase of inflammation, tissue injury, infection is your C-reactive protein. So C-reactive protein, one of the most commonly ordered test which we see in a routine practice, and this CRP test is usually used by the doctors to diagnose inflammation, to monitor the disease and their treatment, etc. So C-reactive protein, as you know, it is a protein. Okay, the name itself suggests that it is a protein, and this is produced by the liver, as most of the proteins are produced by the liver. This is also produced by the liver, and it is an acute phase reactant. That is, this acute phase, what is the acute phase? It is a phase of inflammation, when the body reacts to a infection, trauma, inflammatory agent. That time this protein is produced by the body to fight against this inflammation. ओके जब भी कोई एक इन्फ्लेमेशन रहता है, जब बॉडी को फाइट करना होता है, तब बॉडी ये इन्फ्लेमेटरी रिएक्टेंट्स को प्रोड्यूस करता है फाइट करने के लिए, तो उसको हम बोलते हैं एक्यूट फेज रिएक्टेंट्स. So now this test what we are talking about, CRP test, that will measure how much of this protein is present in your blood, and this will help the doctors to monitor inflammation, to find out how it is responding to treatment, etc. So the name C-reactive protein, it came because the ability of this to bind to the C polysaccharide component of the pneumococcal bacteria. ये जो pneumococcal bacteria है, this is a plasma membrane, this is a cytoplasm, and this is the capsule. So here it is having this outer and inner layer of C polysaccharide. So in the 1930s, they studied that, when they were studying these pneumonia patients, and this pneumonia is caused by this pneumococcal bacteria. So this pneumococcal, when they studied that this outer layer, the C-reactive protein was able to bind to the C polysaccharide of this pneumococcal bacteria, and the bacterial C carbohydrate was the basis of this name. That is why it is named as C-reactive protein. Why the name C-reactive protein? Because it was able to react with the C carbohydrate portion of this pneumococcal bacteria. Okay. So there are different forms of this CRP. You have pentameric form, and then you have the monomeric forms, etc. And they all have this pro-inflammatory product. So you can see these are the different forms: the pentameric form, the monomeric form of C-reactive protein. There is also something called as HSCRP. Okay. So this HSCRP, we will study about HSCRP again in detail, but this is highly sensitive CRP. You might have heard about this test, and this test usually we use in the clinical practice to monitor the risk of heart disease. Okay, this is much more sensitive than the C-reactive protein, but these two are used in two different scenarios also. But remember, there is something called as high sensitive C-reactive protein. So it is very, very sensitive. Very in small quantities, this can be detected, and this is the sensitivity. This sensitivity at very low rate also makes it an important marker for investigation in cardiac diseases. Okay, so usually to monitor the heart disease. Now you all know that C-reactive protein like your serum amyloid B, complement, fibrinogen, haptoglobulin, serenoplasmin, alpha-1 antitrypsin, interleukin-6, all these are acute phase reactants and produced mainly by the liver. Some are produced in the endothelial cells, epithelial cells, connective tissues also, but mainly it is produced by the liver on stimulation with the interleukin-6, and they are the one when they produce all the cardinal signs of inflammation: your redness, your pain, your heat, your swelling, etc. So CRP, basically what it does, I told you that it is a reactant which the body is producing to fight against inflammation. Whenever there is an inflammation, the body identifies it, the immune system identifies it, and it will try to remove that harmful substances. And during that process, it will activate the immune response. The body's complement system is activated, the phagocytic system is activated, the platelets, the WBCs, the interleukins, all the factors are released, and they will see that they remove the bacteria. They will definitely they will try to stop the spread of infection. So these are the main functions of CRP. So basically they want, the body is trying to get rid of this bacteria. It may be either in the form of a clot, that is why fibrinogen is increased, platelets are coming there, so they are forming a clot to remove this bacteria, to stop the spread of the infection. The leukocytosis is high because they are the first line of defense, they go to fight. So that time these inflammatory mediators, the liver also starts producing proteins, such proteins which will fight against these bacteria, virus, fungus, etc. So CRP has various roles, and CRP, it does its action because of all these roles. It induces complement activation. It will increase the LDL uptake and oxidation. It will inhibit the nitric oxide production in the blood vessels, and hence the dynamics of the blood vessel, blood flow, endothelial cells are changed. It induces the production of tissue factor. It inhibits fibrolysis. We do not want fibrolysis. We want the clot formation to be there so that we can trap the bacteria, fungus, etc. So that inhibits fibrinolysis. It facilitates the infiltration of monocytes and your WBCs into the vessel wall. And so these are the functions of the CRP. So I've told you the complement system. Whenever there is inflammation, the complement system is activated, and C-reactive protein activates this classical complement pathway. Okay, so when it does that, it will stimulate our innate immunity in response to the complement system also, so that it will help the clearance and of this pathogens, and also the removal of the cellular debris. So this activation of this complement system, this it will start the cascade of events leading to opsonization, coating of the bacteria, and to inflammation, and also to get rid of that cellular debris also. So that is done by this activation of the complement system. It also influences the oxidation of LDL by binding to its surface, and it will inhibit the further oxidation. See, while CRP, you know that it is a marker of inflammation, it can also be used as a predictor of cardiovascular diseases, what I was telling you in HSCRP, and it has a role in atherosclerosis also. We will study about this again in detail. But remember, CRP also plays a role in the inflammation of the blood vessels also. That is atherosclerosis. That is why HSCRP, etc. are used to monitor the रिस्क ऑफ एथेरोस्क्लेरोसिस एंड हार्ट डिसीज, क्योंकि एथेरोस्क्लेरोसिस भी क्या है, एक काइंड ऑफ इन्फ्लेमेशन ही है। वो इन्फ्लेमेशन कहाँ, इन्फ्लेमेशन इन द ब्लड वेसल्स। सो सीआरपी हर तरह का इन्फ्लेमेशन को मेजर करता है। सो वहां के इन्फ्लेमेशन ऑल्सो वी कैन मेजर विद दिस सीआरपी। सो it does with all these mechanism because it influences the oxidation of LDL also. What does the CRP test show you? The CRP will tell us that there is an inflammation. अगर CRP टेस्ट में आपका CRP लेवल ज्यादा आ रहा है, ये बताता है कि इन्फ्लेमेशन है। बट कहाँ है, वेयर इज द इन्फ्लेमेशन? नो, we cannot make out by doing a CRP test. But yes, if the CRP is high, you know that there is something happening in your body. There is inflammatory process which is going on in your body. So it will help us to diagnose various inflammatory conditions like infection, sepsis, inflammatory bowel disease, arthritis, autoimmune disease, etc. So there is diagnosing inflammation. Second is monitoring the treatment, how the patient is responding to the treatment after surgery or after medicines, etc. And HSCRP, I have told you that it is used to assess the cardiovascular risk. So this is what I was telling HSCRP, and it is more sensitive than the standard C-reactive protein test, and usually used in the coronary artery risk assessment. So the normal ranges of CRP. So the normally we take that the range should be anything between 0.5 to 3 milligram per liter. But in majority of the cases, we take up to 10 milligram per liter as no problem. We are okay with it. It is slightly elevated, but we are fine with it. And you know, up to 10 milligram per liter can happen in diabetes, person who is obese. These are all low grade inflammatory conditions. So in a diabetic, he can have slightly elevated CRP. So he can have up to 10 milligram per liter of CRP. In pregnancy, up to 10 milligram per liter is fine. Okay, so this is slightly elevated, but up to 10 milligram per liter is fine. But yes, if it is exceeding more than 10 and up to 100, then yes, there we have to evaluate, and it shows that some kind of an inflammatory process is definitely going on. It could be rheumatoid arthritis, Crohn's disease, SLE, pneumonia, osteomyelitis, any inflammatory condition. There is some kind of an inflammatory process happening in the body, and if it is more than 100 milligram per liter, then yes, definitely there is some kind of a major trauma, there is severe bacterial infection, etc. But remember, there are many factors which can affect your CRP also, your genetic factors, your lifestyle, less sleep, etc. They can also affect your CRP. Stress can affect your CRP. Sleep, I have told you, can affect your CRP. Your pre-existing medical conditions, your environmental influences, all these things can also influence the CRP. That is what I was telling you. Though the normal range is up to 3 milligram per liter, we take up to 10 milligram per liter. We do not go overboard and do anything if it is up to 10 milligram per liter. But if it when it crosses more than 10 milligram per liter, yes, that is when we will have to definitely evaluate the patient with other tests and scans, etc. So CRP is high. Now patient did a test and CRP came high. It is more than 10 milligram per liter. Then it could be because of an infection. It could be bacterial, viral, fungal. The most common causes of this increase in CRP: pneumonia, patient is having osteomyelitis, patient is having lung infection, etc. This CRP will rise. Autoimmune disease, patient is having SLE, rheumatoid arthritis, he is having a trigger of SLE. All these conditions can stimulate this CRP. He is having Crohn's disease, ulcerative colitis. So inflammatory, certain type of cancer, you know, a certain lung cancers and colon cancer can lead to increased CRP levels. Heart condition, I have told you, whenever the patient is having atherosclerosis, etc., CRP can be high. If there is any trauma, injury, CRP can be high. Patient is smoking, patient is under chronic stress, he's not sleeping properly, if the diet is bad, if he's having more of saturated fat, patient is obese, CRP can be high. All these other causes of CRP: obesity, atherosclerosis, type 2 diabetes mellitus, heart disease, certain allergic condition, sepsis, cancer, and certain infections. So we will study in detail why CRP is raised in all these conditions also, so that we get a better idea. So in the coming classes, we will see why CRP is raised in obesity, what happens to CRP in atherosclerosis, what happens to CRP in diabetes mellitus and heart disease, etc. Okay, but yes, whenever CRP is high, think of all these possibilities. Most common is your infection, but yes, it can be autoimmune disease also, it can be atherosclerosis, type 2 diabetes mellitus, it could be heart disease, it could be sepsis, certain cancers, and also certain other factors like stress, your environmental factors, etc. They can also increase your CRP. What are the key points about CRP? CRP is an acute phase reactant. Whenever there is inflammation in the body, tissue damage in the body, this CRP rises. So if CRP is high, it suggests that there is inflammatory process going on in the body. But where is it going on? CRP will not tell you. So it is a non-specific marker. It doesn't point out where exactly is the inflammation going on. It is not a very specific test. Okay, so it is not unique to one disease, that you should remember. And CRP, we use it to monitor the disease, how it is progressing, how the patient is responding to the treatment, how the patient has recovered from surgery, etc. We use to monitor this CRP. This was all about C-reactive protein. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.